morning, everybody. Good morning. Thank you for taking time out to and listen to what we have to say. We are from mHealth. My name is Dr. Eka. This is Dr. Valerie, Dr. Lecky, and Miss Miriam. She's from our media department. What we virtually do in our company is that we are like a mobile medical network. We do practice mobile medicine and e-medicine. So right now, what we have some certain services that we perform. I'm sure sometimes on your phone, you usually see these health tips from MTN. Etisalat has it as well, and Airtel as well. That when you subscribe, there are different categories. Like we have pregnancy for women that are pregnant. We'll have fibroid, we have hypertension, we have diabetes, we have cholesterol, we have fertility. There are different categories. So you can subscribe for 15 naira per week. Then every day you get a health tip that is specific to you. Then we are also in partnership with this for Airtel. We have what we call mobile midwife. That one is for women that are pregnant or women that have just delivered. So when you dial in and you register for the short code, it asks for your last menstrual period so that it can help you date your pregnancy. So that one, you'll be getting 5 tips a week that are specific to the stage of your pregnancy for what you need at that particular time. Then apart from that, you also get a voice recording, like a message, one message a week. Then it also creates a network for mothers that have given birth so that you can also chat with other mothers. You can get ask questions about immunization, about what they call it, about breastfeeding, lactation, and things like that. Then we also have the services where you can call in and speak with a doctor. For Airtel, we have what we call the Dial a Doctor. It was launched around October last year. So we have this code for if you want to call in from 8 o'clock to from 8 is virtually 24 hours, but it's really active from 8 a.m. to 8 p.m. You can call in on any Airtel number if you dial 67777. That is 13 naira per minute. So that's 6 and you get 47. Then that one you can call in and you speak one-to-one about to a doctor. Like maybe sometimes you might not feel like going to the hospital, but the main aim is not to drive people from coming to the health center or to drive people from coming to the hospital. Instead, we're trying to promote health like they do abroad to make sure that people come here, but also they can get some knowledge. I know that there are some questions sometimes when they come, they might not be able to ask their doctors some certain questions in person. Then, in the general hospitals, like, sometimes when we are seeing like 100 patients in a day, we might not really have time to really sit down and chat with patients. So then you can talk to your doctors one-on-one. That is on Airtel. Then we have what we call the Airtel conference chat. It holds on Tuesdays and Thursdays, but this one, the code for that one is 67778. I will drop all the short codes to the matron so that people can see them, because I know that it's hard to get the numbers. That one, we normally pick a topic for discussion. Maybe today we'll pick obstetric hemorrhage. Then people call in, we talk to them about obstetric hemorrhage. And if you know someone experiencing anything or you have any questions you want to ask, you can call in and talk to us. Then for MTN also, we have what we call a doctor. Then Mondays to Thursdays, we usually have from 8 o'clock to 5 p.m. If you call 35123, you can speak to a doctor one-on-one. But on Fridays, we have what we call the MTN conference chat. That one has been running for a while and it's a bit down. Airtel is 13 naira per minute, but MTN and Etisalat, they are 15 naira per minute. So for our conference chat every Friday, we have 32123. You just call those numbers, you will speak with a doctor on a particular topic. That one is, we always send out a media blast before time, like on Thursdays, about the topic we'll be discussing. So if you are interested, like last Friday we discussed infertility, we had a lot of calls. Although majority of our callers are usually from the north, where they don't really have access to doctors, unlike here in Lagos, everybody at hospitals everywhere. Then for Etisalat, the call and speak privately with a doctor, you just is 33122. So that is 33122. So any questions, please? Or do you want me to repeat the codes again?
No, I will read it.
Okay, I will paste it. I will paste it. Okay. So that's what we virtually do. So please feel free to call us at any time. We are there. And for the doctors, we just want you to know that we are not trying to take your patient. We are trying to promote healthy living, promote health, and our aim is to drive people to the hospital, because you know we're all working in conjunction to try and get the MDG, that are Millennium Development Goals. That 2015 was the deadline, and we've still not achieved it. So that is the aim. So we thank you very much for allowing us to speak with you. Have a lovely day. Thank you very much. Thank you very much. Thank you.
No, doctor. Doctor, what's your name?
My name is Dr. Eka. Delta State.
Okay. I need to ask like that.
I know, there's no problem. Thank you.
Have been around for a while. The company has been functioning.
Yes, that's been, but it's
My first time of hearing. I get to see the messages, but I didn't know it was a firm impact.
you just that when you were last year, when Excel came up, we tried to promote it. So right now, we're trying to create awareness on the MTN. So like the conference that usually gets for like more than 30 times. We just started like last month. So we just came
And what's your name?
and I saw those messages.
Dr. Miriam Abi.
I started working for them. I get all those messages. I said, all these people want to we have different categories. Thank you. Okay, I'm here with the head matron of the Ajao Primary Health Center. We would like to tell you, we would like you to tell us like what you people do here.
At Ajao PHC, we attend to pregnant women.
Yes, ma'am.
We give them a talk
Yes,
on how to take care of their self and their baby. Then, after the delivery, we ask them to give their baby breast for 6 months, and we ask them to go for immunization, BCG, OPV, Delta, according to the age of the child. Immunization starts at birth, BCG, OPV 0, and HPV 0. During the clinic, we do advise them on family planning so that they can have time to take care of their baby and their self. And when they want to deliver, we ask them to go to Lassa PHC because we are running 12 hours here. We don't have 24 hours.
Okay.
It's only one PHC in the solo SCDA that
Those
we have 24 hours.
Okay. Thank you very much for having us, ma'am. Okay, what do you think about our services like we discussed about mHealth? Do you see it as something that can help the pregnant women in this environment?
Yes, it can help them. Okay. Because when they are at home, when the nurse is not there and when the doctor is not there, they can easily pick their phone, call a doctor and ask any question that they
they
want to know about themselves and their children.
Okay. Thank you very much for having us.
Thank you.
Have a nice day.
What do you think about our services? We've spoken to you about it, and we just want to know what you think about it and if it will be helpful to your patients.
Yeah, I think it's a very brilliant idea. I've always been seeing the messages. I was telling one of your colleagues that, but I didn't know. I thought it was just something that was solely from the telecommunications company until I heard that today that it's something from your organization. I think it's very good. It's going to promote health-seeking habits among our patients and then ready access to healthcare. So really, I don't feel like you guys are going to take the patients away from us. But to me, I just feel like people can have easy access to healthcare, even from the comfort of their homes. And I think that's very good. That's like the future of medical practice in Nigeria. It's already functioning well outside Nigeria, and I think that's so good.
Do you think it's something that can be brought to the grassroots? Do you think it will be welcomed, especially in this community where people are really not accepting such?
Yes, I think it is, especially Lagos. Lagos, people are more enlightened in Lagos than elsewhere. And I know that there are more people, for instance, the use of mobile phones is more common in a place like Lagos, and it's going to be easy. For instance, this is the basic unit of healthcare. So if you can reach out to people at the Premier Health Center and they can know about this, then sure you're reaching out to a lot of people in the society already.
Thank you very much.
Thank you. Nice having you around.
Thank you. It's the same here.
Okay.
All right. Thank you.
Thank you.